another episode of MedSynapse podcast. I'm your host Hetvish, and today we are diving into a critical topic of brain aneurysms. These silent threats can have devastating consequences if they are not treated and detected properly. Understanding and treating these aneurysms require expertise and precision. And that's exactly what our guest today excels in. I'm thrilled to introduce Dr. Manisha Joshi, an experienced interventional and neuro-radiologist with over 15 years of experience. She's dedicated to expanding and improving the use of endovascular and minimally invasive procedures to enhance public health and quality of life. She brings a wealth of knowledge and expertise to our discussion today. So, welcome to our podcast, Dr. Manisha. It's a pleasure to have you with us.
Thank you, Happy. Good evening. Hope you are doing well. So, thanks for inviting me to this podcast, and thank you for choosing this critical topic. As you told, it is a very critical topic, and the disease may be lethal in some cases, and the preventive as well as the treating methods are very important.
So, to start with, can you share with us the path that led you to specialize in interventional and neuro-radiology?
So I have done my MBBS initially to become go on the path of becoming a doctor. And after my MBBS, I had done my PG in radiology. And as a field of radiology, is a very fascinating field where you see the diseases directly. And that was something which was a unique thing about the field I found. And after going into the field of radiology, we found that we are seeing the diseases directly, and we are seeing how they have been treated. And then I found out that there is a further path in the radiology where actually we can treat the diseases by the way of imaging which we are doing. When we are in radiology, we do a lot of imaging of the body parts of the person, like ultrasound, like MRI, like CT scan, like angiograms. And in all these, we can see that how the diseases are found. And nowadays, with the advanced technology, without opening the body, by the minimally invasive way, by putting a small hole, a small cannula-like thing in the blood vessels, we can go to the distant part of the body, and we can treat the diseases which are lying in distant part of the body, especially in the blood vessels. So after doing my residency, when I found out during and after the residency that this is a further field which I can enter into, I was really interested in it, and I started finding out that how can I find a place where I can get trained in it. I was lucky enough to find an institute like a PGIMR Chandigarh, which is a very reputed institute of India, Central Institute of India, and I could get into and do my 3 years training in the DM Neuro-radiology over there, which was a turning point of my life. And after that, I entered into the minimally invasive treatment of the brain diseases as well as the other part of the body.
Thank you for sharing your journey. It was an impressive journey. Now, moving on to our main topic, what exactly is brain aneurysm, and can you provide an overview of different types of brain aneurysms and what their typical presentations?
So, brain aneurysm basically is a weak point in the blood vessels of our brain. Although aneurysm can happen in any part of the body, the blood vessels, the brain aneurysm typically happens in the blood vessels which are inside the brain, and they have some typical features and typical implications. So that's why the brain aneurysm needs a special mention. So coming to the types of the brain aneurysm, we can divide them in a different way based on the size, based on the causes because of which they happen, or based on some other pathologies which are associated. But commonly we divide them into the secular or the fusiform aneurysm. Secular aneurysm means it is something like a berry aneurysm. You can imagine a vine from which a berry is hanging. The common brain aneurysm are like that. They are called as secular aneurysm. Another type is fusiform aneurysm, where the blood vessel is not bulging at one point like a berry aneurysm, it is bulging all around the wall of the blood vessel. You can imagine seeing a pipe where in one pipe there is a damage which is bulging on one side, and in another pipe there is damage because of this whole pipe has become like a bulb. So that is called as a fusiform aneurysm. There may be another way of dividing it into dissecting or true aneurysm, where in the true aneurysm we say that all three walls of the blood vessel are preserved, while in dissecting aneurysm doesn't contain all three walls of the blood vessel, and they are more fragile and they are more dangerous. And there are another kind of aneurysm typically mentioned as mycotic aneurysm. Mycotic aneurysms are basically happens because of the infection in the blood, which can enter into the blood vessel of the blood. It can damage the blood vessel, it can weaken the blood vessel, and it can rupture, which are again a very dangerous type of the aneurysm, which has a more lethality rate. And the symptoms of aneurysm are variable. If it is not ruptured, then it may not have any symptom. And as per the various data, there is a different incidence of the aneurysm of the brain, but as a whole, many of the studies says that out of 100, 3 people has the brain aneurysm. But not all brain aneurysm are lethal, not all brain aneurysm are risky, and not all of them need a treatment. According to data, it says approximately out of 1 lakh, 10 people have a rupture of the brain aneurysm. So suppose if 3,000 people has an aneurysm, out of them 10 will have a rupture over time, and that is rupture rate is not as high, but if the rupture happens, it may be very, very dangerous. Considering the symptoms of the brain aneurysm, usually if it is not ruptured, a person doesn't have any symptom, and it may be incidental finding when you do the angiogram, CT scan, MRI for some other reason. But if it is ruptured, which is a very, very highly lethal condition, in that condition, the most common symptom the person has is a severe headache. It is a sudden severe headache. Along with that, person may become unconscious, person may have a seizure, person may have a vomiting, and it can be immediately lethal in almost 25-30% people. Along with that, there can be other symptoms, like some people may have something called a warning headache, which is not a very sudden or very severe or very intense headache. It may be a minimal headache, or it may be a sudden but a very transient headache. But usually it is followed by another major bleeding over the time period, and if it is missed, then the person may have a lethal bleeding afterwards or a major bleeding afterwards. Sometimes unruptured aneurysm can present as well with the symptom. It can be because of the pressure effect in the brain. It can, if it is large, it can cause a pressure effect in the brain. It can cause a pressure effect on the nerves around it, which can be resulting in the pain around the eye or behind the eye. It can result in the dilatation of one side of the pupil. It can result of a visual disturbance or a ptosis. Ptosis means the one of the eyelid can fall down and it may not work well. So these are the common presentations. Along with that, there can be some rare presentations as well, resulting in the involvement of other cranial nerves or sometimes just as seizures. So these are the usual and common presentations.
Thank you for explaining that in detail. Now, what are the treatment options, especially when choosing imaging modalities for patients, and what factors do you consider for different patient populations, such as those with comorbid conditions or contraindications to certain tests?
So, when we suspect a brain aneurysm, most common imaging modality and the best imaging modality used is the CT angiogram, first of all. CT angiogram gives us the idea of that how much bleeding the patient has and what is the condition of the blood vessels of the brain, and it is very, very sensitive and specific in finding out the aneurysm in the brain. So commonly CT angiogram is the first imaging modality. But in certain patients where the CT angiogram may be having a contraindication or relative contraindication, we do the MR angiogram as well. So patients who has a kidney disease or have a high risk of kidney disease, who has a high creatinine, they have a higher risk of developing the renal dysfunction after giving the contrast which we use for the CT scan. So in those patients, we are relatively more conservative in giving that contrast, and we prefer to do a MR angio as a first modality many times if the patient can do it, because MRI again may have some challenges. It needs longer time to be done. Patient has to be in the gantry, and some people may have a claustrophobia. Person who has a recent rupture of aneurysm may not be able to cooperate that. Those may be challenges to the MRI. Again, sometime in the aneurysm which are unruptured, and we have to make a treatment decision, and patient doesn't have any other related issues. Or if the patient has a multiple aneurysm where we have a dilemma that which aneurysm has ruptured, MRI, special MRI called as a vessel wall imaging, can help in making a treatment decision whether this aneurysm should be treated or not. If there are multiple aneurysms, which aneurysm should be treated. Again, the gold standard imaging, if we talk about the aneurysm is basically a angiogram. Angiogram means it is an invasive investigation. You must have heard about the angiogram which is done for the heart. Same way, the angiogram can be done for any part of the body, and when angiogram is done for the brain, we go into the brain blood vessel, doing a small puncture, small hole in the blood vessel in the groin or in the arm. From there, we can take a small tube inside the blood vessels which are going to the brain, and we give an injection of dye under the X-ray machine, special machine, and then we check the blood vessel status. Again, in that we have to use some dye. So we have to definitely see if the patient, how's the patient renal function. Sometimes even with the poor renal function, we have to do it because we don't have any other option to identify the lethal disease, and the risk of the life is more than the risk of the kidneys. So angiogram nowadays we have a lot of advanced softwares in the angiogram as well, like 3D rotation angiogram. We have a VASO-CT, and all these things give even more detailed information about the blood vessels. Other imaging modalities can be rarely used, or some other diagnostic modalities like a CSF fluid analysis and all can be rarely used in certain specific scenarios.
Yes, that was very insightful. Now, can you discuss the minimally invasive techniques available for treating brain aneurysms? How imaging plays a role in guiding these treatments, and how do you determine the most appropriate treatment approach based on aneurysm size, location, and the patient's overall health?
Yes, sure. So, if we consider the aneurysm, usually they present after the rupture. Some of the aneurysm may present without a rupture. So, when the patient presents without a rupture, and we do the all detailed imaging, we have to decide based on the patient's factors that whether it is a high risk for rupture or low risk for rupture. If it is a low risk for rupture, we should usually keep on follow up. We don't treat that patient. And if it is a high risk for rupture, we usually advise a treatment. For treating the brain aneurysm, there are two main modalities as of now. One is the endovascular modality, which is a minimally invasive modality. In the same way as I described the angiogram, we put a small hole in the blood vessel in the groin or in the arm, and from there we go inside the brain blood vessel. And at the distant location, we park our catheter in the neck or the brain blood vessels, and we treat that aneurysm. And another modality of treatment is the surgical clipping. In that, surgeon open the brain and they go inside and put a clip across the aneurysm. So now, what are the possible treatments? And we have to decide based on the aneurysm shape, size, aneurysm location, patient condition, as well as how much bleeding the patient has, because majority of the patient present with the rupture. So how much bleeding the patient has. If the patient has a large amount of bleeding which needs a surgery to open the brain, and along with that person has an aneurysm which is peripherally located, like a middle cerebral artery aneurysm, anterocommunicating artery aneurysm, or sometimes a distal anterocommunicating artery aneurysm, surgery is nowadays also a preferable modality. And in the aneurysm which are located in the posterior circulation, which are more difficult or more high risk for the surgery, and the aneurysm which are in the deeper location where the endovascular is a preferred modality. But even the aneurysm which are located in the anterior circulation, like the middle cerebral artery or the anterocommunicator artery, where the patient has a more high risk of a bleeding, or patient doesn't have any large hematoma to need an immediate evacuation, endovascular treatment can be preferred depending upon the patient's scenario. And when we do the endovascular treatment, we consider the imaging findings which are in the CT scan, CT angiogram, MR angiogram, as well as the DSA. And that is the guidance, and basically the DSA or digital substrate angiogram or angiogram is the main modality which is used to guide into the procedure during the treatment. For the minimally invasive treatment, if I talk about now, our purpose in the minimally invasive treatment or a clipping is to reduce the risk of a bleeding from the aneurysm or reduce the risk of repeat bleeding from aneurysm. So in that condition, we have to try to reduce the blood flow into the aneurysm. If the aneurysm is like a very, as I told you, secular aneurysm first, usually it is possible to place the coils inside by minimally invasive way, and we can close it by the coils. Sometimes we use the stent along with the coil depending upon how are the risk factors of the patient. In some aneurysm, it is not possible to place the coils, or coils can be placed in just a minimal part only, or they have a high risk of a regrowth even after the coil placement. We use the stents along with that. There are certain kind of special stents as well for the aneurysm which are called as a flow diverter stent. These are placed across the aneurysm neck or across the aneurysm in the artery, and they can reduce or they can reduce the flow in the aneurysm, and they can divert the flow away from the aneurysm, and they can allow the vessel wall to heal over time, and the rupture risk can be really low. Another thing nowadays, I would like to make a special mention that along with these devices, we have something called as intracellular devices, which means that there is something like a cage kind of thing which we place into the sac of aneurysm, and once that is placed, that also act as a flow diverter, and it can reduce the flow inside the aneurysm, and sometimes it gives an advantage of reducing the blood thinners or the antibiotic medications which the patient is getting. So these are the main minimally invasive treatments along with the surgical methods which I explained to you. Depending upon the size, shape and the location of the treatment, we have to decide that which device is better in which kind of the aneurysm.
Thank you for shedding light on that. Now, what are the most effective preventive measures that individuals can take to reduce their risk of developing brain aneurysms, particularly those with a family history or other predisposing factors such as high blood pressure, smoking cessation, and alcohol intake?
So yes, so that's a very good question, and as you mentioned that the high blood pressure, smoking and the family history, they are high risk factors for the aneurysm. So for that I would make a few comments. Possibility of the cause of the aneurysm, what are the possible cause of aneurysm, and what are the possible cause of rupture of aneurysm. As we discussed earlier, that aneurysm is not something which is uncommon condition. Out of 100, 3 people can have it, or even according to some study, it may be more than 3 as well. And rupture of the aneurysm is not that frequent compared to the incidence of aneurysm. But we see, according to the studies, that it is aneurysms are more common in females, has a more chance of rupture in the females. Aneurysms has a more chance of rupture with the older age. Aneurysm has a more chance of rupture or occurrence in the people who already have a family history of aneurysm, or it has a more chance of rupture or occurrence in the people who smoke. So these are the certain risk factors. So among the risk factors, some of them are a modifiable risk factor, some of them are non-modifiable. Non-modifiable means female gender is not a modifiable risk factor, family history is not a modifiable risk factor. For those, there is not something specific which can be done except for this screening modality used in some cases. But the modifiable risk factor, the most important are smoking and high blood pressure. So if the person has a risk of high aneurysm, the two most important things the doctor advises is to keep the blood pressure in proper control, as well as to stop the smoking completely if the person is smoking, and if the person is not smoking, never do the smoking. These are the two most important things. Along with that, it is always important to follow a healthy lifestyle, because the overall healthy lifestyle, overall health is related to every organ of the body. So of course the brain also get affected by it. Another common risk factor for the aneurysm is a drug abuse or substance abuse, especially the cocaine and all. They can increase the risk by two things. One is they can increase the high blood pressure in the person, and another thing, people who are substance abuse, they have a high risk of infection in the blood, and they have a high risk of a mycotic aneurysm, which I mentioned in the initial, which are one of the most lethal kind of aneurysms. So substance abuse, bad health habits, those should be definitely to be avoided. Now of course alcohol also doesn't have a direct relation with the aneurysm directly, but it can increase the risk of many other health issues, and it can increase the risk of bleeding and aneurysm also.
Yes, that was a great advice, and I think everybody should take those preventions. Now, are there any medical conditions or diseases that can develop as a result of brain aneurysm, particularly following its rupture, and how can these complications impact patient management and prognosis?
Yes, that is a very, very important topic and very, very important aspect of the aneurysm to understand, because once the aneurysm ruptures, it has I would say in my words, it's kind of a package of diseases, because once the aneurysm ruptures, it will have a bleeding in the brain. Now that bleeding which has happened in the brain, that has a multiple consequences. One, it can have a direct consequences on the brain. It will increase the pressure in the brain, and it can cause a sudden edema, sudden swelling of the brain, which can be lethal to the life immediately. If the person can survive that time, and if the person did not have that much of a high pressure, in the future, what's going to do is that it can increase the pressure of the fluid in the brain, something they call as hydrocephalus, Person may need ways of or surgical ways to divert the fluid from there, which can be done by the EVD or the external ventricular drainage, or it can be done by the patient in the delayed phases in some cases, or by the lumbar puncture as well. Another thing this blood can cause it, this blood remains, usually the rupture of aneurysm happens in the blood vessel around the brain. And when it happens over there, the most commonly the location of the blood which remains is in between the brain as well and the membranes which surround the brain. So we have some fluid called as CSF, which is in between the membranes of the brain as well as the brain, and that is the most common location of the bleeding which happens. And all the blood vessels of the brain lies in that area. Because of the blood being over there, although body resolves the blood slowly over time, over the few weeks to few months time, but the blood vessels which are there, they will get shrinkage, they will become small because of the irritation from the surrounding blood, and that can result in any other kind of ischemic stroke as well. Ischemic stroke means when the blood vessels stop getting the blood flow to the brain tissue starts dying. And the person can have many other consequences related to that. It can be a major or minor stroke, it can be result in the coma, it can result even in a loss of life. So these are the few most important effects of the bleeding which happens in the brain as a result of rupture. Another thing that because it is a stressful condition, many of the patient needs a ventilator, many of the patient needs a ICU. It can have a higher risk of infection. Sometimes even the stress which happens because of the blood aneurysm rupture, that can result in something called as stress cardiomyopathy. It can result in the reduced pumping of the heart. So stress cardiomyopathy will affect the heart, and the heart will have a reduced pumping, and the person may have a low BP, may need a multiple nitro support. So it is something which affects the multiple organs of the body, not only the brain.
Yes, understanding these complications is essential. Finally, what role do artificial intelligence or AI and machine learning currently play in the diagnosis, treatment, planning, and outcome prediction for brain aneurysms? And are there any emerging technologies or techniques in this field that you are particularly excited about?
Yes, so artificial intelligence and the machine learning is something which is very exciting for almost every field, and especially for the medical field. We are yet to know the proper or complete implications of that, but we have some potential areas, potential field where we are hoping that we will get a better management of the patient after getting these artificial intelligence and the machine learning programs. So one of the most important thing is some people who has the high risk of developing the brain aneurysm, or the people who already had developed brain aneurysm, they usually need a regular follow-up, they need a regular screening. So for those patients to do the screening and to keep the screening data, it is very important to it is a very important tool having a artificial intelligence or machine learning, that we can do a follow-up in a more straightforward and more smooth way. And those patients, risk prevention can be done better with the future machine learning programs. So we already, it's a usual way of follow-up in most of the countries that person who already has a bleeding from the brain aneurysm will keep them on the follow-up quite some time. Initially it may be close follow-up, later on it may be a little distance follow-up. Second thing, the screening program for the brain aneurysm are not very strong or not very common right now, but in the future we might be having a more common screening programs. Third thing, that as I told you, aneurysms are not something very uncommon. Out of 100, 3 people may have aneurysm, but when the person is diagnosed with aneurysm, it is a dilemma for the patient as well as sometimes for the physician that to treat it or not. Not always we have a clear answer. With the tools from the machine learning and the AI, we are hoping that in the future we will have a more clear answer and more objective answer for the patient as well for the physician that this aneurysm should be treated or not. So definitely we have a golden hope in the future, and we are yet to know that how much it can impact and when it can impact it.
Yes, the potential of AI is immense. This has been a fascinating discussion, Dr. Manisha, and thank you for sharing your expertise with us today on this critical topic, and we are thankful for the opportunity to learn from your expertise.
Thanks a lot. Have a nice evening.
You too. And to our listeners, thank you for being here and listening to the podcast. And if you are a healthcare professional with questions or an interest in exploring more medical topics, remember to connect with us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until next time, take care and stay healthy.